Hi everyone, my name is Julia Tang and I'm a physical therapist. I'm here today with my 4 favorite exercises for regaining shoulder range of motion. So over the past couple of years as a clinician, I've had several patients with either shoulder surgery or they've had frozen shoulder, otherwise known as adhesive capsulitis, and they just have a really hard time getting their shoulder range of motion back. And we can push and pull and crank on that shoulder as much as we want, and oftentimes that'll actually flare up the symptoms and make people feel worse or have more pain. So really what I've landed on is these 4 exercises that really help regain the major directions of range of motion, and people feel like they're in control the whole time, and usually strengthening and stretching the muscle at the same time, lengthening and using it at the same time, is just a little bit more comfortable than purely stretching it. So the 4 exercises are going to be lat pullovers, chest flies, supine resisted internal rotation, and prone swimmers. So for all these exercises, make sure you start out by choosing a weight that you know you can control. Start out lighter than you think you need to, and then you can slowly progress as tolerated. I would do these all on the ground instead of on a lifting bench, just to limit the range of motion, just to start. And then you can always reduce the range of motion, and you should reduce it just to the amount where you can really control it rather than trying to let the weight completely just get out of control here. Okay? So let's take a look at these 4 exercises. The first one is a lat pullover. So you're going to lay flat on your back, and to make it easier, you can use one weight and hold it with both hands, or if you want a little bit more challenge, you can hold one weight in each hand. So I'll show you first just holding one weight in both hands. So you just lay on your back. The weight's going to start directly with arms directly above your shoulders. You glue your lower back to the ground, pin your shoulder blades to the ground, and then slowly lower the weight overhead as far as you can control. So here, the main thing is being able to control the weight. So oftentimes people will get to about here, that's it, totally fine, you come back straight over your chest. So this one I'd recommend doing about 10 reps of each, as long as it's comfortable, and you just lower as far as you can each time, maintaining the weight under control, and then raise back up. So the main things, we don't want to see your back arching off the ground as you lower, and we also don't want to see the shoulder popping forward as you lower. So back on the ground, shoulder blades pinned down, and then lower. And you don't really have to hold it at the bottom. You can maybe hold it for a second or two, but just try and keep the motion nice and smooth here. And these you can do as many times per day as you want. Usually it's comfortable to at least take a few hours break between these exercises here. So maybe like aiming for anywhere between 2 to 5 times a day would be a good place to start if you're really working on your range of motion here. Okay, so that's the lat pullover. So just to demonstrate the 2 weight version, so you would choose some lighter weights, hold one in each hand. This makes it a little bit harder for the shoulder stability since you have to control each weight separately, but this would be a way to progress the lat pullover here. Okay, so that's the lat pullover with 2 different weights. So the next one is going to be a chest fly. So this one you will actually need 2 weights. So same thing, you're going to be lying on your back. Weights are going to start directly over your chest. This one, definitely make sure you use a weight that you can really control. Go lighter than you think you need to. Again, back glued to the ground, and you're slowly going to let the weights lower down to your sides. Don't let your hands hit the floor completely, and then bring them back up over your chest. I usually inhale on the way down, exhale on the way up. So make sure you use a weight you can control. And if this is really scary, and if you can only go really part way, you could also do this with your affected side next to a chair or a couch. So it has something that if you lose control, you can actually just rest and then drop the weight onto that surface there, okay? So you don't have to go all the way to the ground to start. You can always do this next to a chair or couch just to limit the range of motion. And again, I would do about 10, maybe 15 of these, and you can do these anywhere between 2 and 5 times a day if you're really working on range of motion here. Just try and give yourself a couple hours of break between each set, just to let the shoulder recover. But you can see this is strengthening the pecs as well as lengthening the pecs and the front of that shoulder, all the muscles in the front of that shoulder, just to help you get a little bit more range of motion out to the side. So you can lower the weights down, and that's the chest fly. The next one is going to be supine resisted internal range of motion. So you're actually going to be in the same position as the other two, again, laying on your back. When you lay on your back, you're just going to slowly let the weights go up to the side. So start with your elbows by your side here, and then as you get better and better range of motion, you can raise the elbows up a little bit more out to the side of your body. So starting point, again, choose a weight that you know you can control. Elbows by your sides, slowly let the weights fall out, and then bring them back in. And so this is the easiest version. And then as you get more range of motion, or if you get your surgical precautions reduced or lifted, you can bring the elbows out, which is actually going to change the angle that the weights are going at it. Since you want to keep your elbow at 90 degrees here. So if your elbows are more out to the side, it's going to be more of a diagonal track that the weights are going on. And then once you get really good, you can bring your elbows all the way out to 90 degrees of abduction, and then slowly lower the weights towards the ground. And here it's going to be kind of like a vertical track that the weights are traveling on. And again, don't let the shoulder pop forward, so keep those shoulder blades pinned to the ground. And also your lower back pinned to the ground here. So that's the supine resisted internal rotation. And then we're going to go over the prone swimmer. So that one you're going to be laying on your stomach. And so this one is one where you start out where you just lift your hands off the ground, and then the goal is eventually to swim your hands all the way around above your head. So start out laying on the ground here. So you're just going to levitate your head off the ground, tuck your chin slightly, get the back of your neck really long. Put your hands behind your hips. If this is all you can do right now, this might just be where you have to start, just lifting the hands off the ground. But if you can get here, you're going to lift your hands behind your hips, lift them straight up towards the ceiling by peeling the shoulder blades back, lift the hands, and the full swimmer is to swim out and around, all the way behind your head, and then back, and then relax. So to start, you may only get to lift here, lift hands off, and most people only get about halfway and they have to come back down. That's totally fine, so that's where you start. Peel the shoulder blades back, lift, swim out and around, come back. You may even only be able to do the lift. Sometimes I'll just have people start here, lift off, hold for 3, 2, 1, relax, and then repeat. So peel back the shoulders, lift the hands, 3, 2, 1, relax. And then you should slowly be able to work your way up towards peeling the shoulder blades back, lift the hands off, swim out halfway, come back down, relax. And the goal is to peel the shoulder blades back, lift off, swim out and around, all the way behind your head, and then go all the way back down. And this one's pretty hard, so I usually only have people do maybe about 5 full repetitions of these, even with just the lift-offs. Just doing 5 repetitions of those can get pretty challenging here. So we got one more swimmer. And that is it. So those are my 4 favorite exercises for regaining shoulder range of motion. Whether you have frozen shoulder or shoulder surgery, or you're just really stiff in those shoulders, give those a try and hopefully those help. Thanks for watching.